Hi, my name is Shelly Ridner. I'm one of your applicants for the doctorate program, Occupational Therapy. My NSU number ID is N018313335. So first let me start by saying I want to address the panel, all of you that are viewing this video. I would like to say I appreciate your time, energy, and consideration for me. Thanks for giving me this opportunity. I'm not the typical grad student. I waited years to be able to go back to school and pursue my education. I was married and a mother at a young age, and I've already had the best job in the whole world. I've had the privilege of raising 4 amazing children. I have 2 boys and 2 girls that are primarily completely grown, and now I have 4 unbelievable grandchildren. So everything beyond this is just a bonus. I want to be an occupational therapist because I feel like in that position I would have the opportunity to work with a huge population. I would be able to help improve their quality of life by making improvements and giving them tools to combat their impairment or disability. We all work to take care of our families like I have done for years, and I could choose a job in several different disciplines that would still support my family. But I feel as an occupational therapist, I'm actually contributing to them as their whole person and enabling them to continue their life and improve their life, including things that they do with their families, things that they just do that make them who they are. So with a disability or an impairment or even a disease, it hinders their full potential, and I want to be able to help people regain their full potential and be able to continue to support their families and enjoy their families. And that's really what it's about for everybody. We all work to take care of our families, and I feel like that would be the biggest impact to help someone else, is to be able to continue allowing them to take care of their family and be a part of their family. The first I heard of occupational therapy, I was actually pursuing my undergraduate as pre-PT, and I was introduced to occupational therapy, and then after I started doing job shadowing for physical therapy, I was able to work with a shadow occupational therapy, and that's when I realized that I feel like it's a better fit for me. I feel like occupational therapy looks at the full person and who they are and what they do that makes them that person, and they work on all those areas to help improve their life and function. And physical therapy, although vital, it primarily is restrictive, and it looks at just their physical abilities and their impairments. The occupation looks at the whole person, not just what they need to help and what they need to do to repair. I just feel like occupational therapy has a bigger impact. The differences between physical therapy and occupational therapy, I think mainly is that in physical therapy, it's restrictive, and the concentration is in physical impairment and to restore that impairment or illness, to bring about an improvement in their function. But it's just within the physical domain. Occupational therapy looks at the whole person and not just the impairment or the illness that they have, but to improve their complete life and function. So I feel like you have more of an opportunity with occupational therapy within that discipline to add more and improve more with a person's life. Physical therapy is vital within the rehab and medical for patients, and occupational is also extremely vital in bringing about an improved outcome. The reason I am pursuing a doctorate degree as opposed to the entry-level master's degree is mainly because my self-determination. I ultimately would love to achieve my PhD. So this is a stepping stone to get to that goal. I've never just taken the easy path. I pursue what challenges me. In 10 years, where do I see myself? Let me start by saying where I was 10 years ago. 10 years ago, I had no education. I left school pregnant at 16, so 10 years ago, I was in a marriage with a controlling man who wouldn't allow me to pursue my education or really anything out of my home. In 2008, I decided I wasn't waiting any longer, and I would continue to strive and work hard to get a career that I could actually contribute to society. 10 years from now, I'm hoping that I will have completed my PhD and I will be actively engaged in research and coming up with innovations and collaborating with other colleagues on improved treatments for patients with impairments and disabilities. And also, I would love to teach so I can pass on my passion to help others. Because in the end, it improves life for everyone. I'm hoping that the NSU program, OTD program, is going to allow me to be successful in learning and acquiring the academics so that I can practice with my OTD and then continue and strive towards my PhD, which is also offered through NSU. So I'm hoping that they're going to be my backbone for my success. What do I know about the NSU Tampa entry-level doctorate program? I know that it's a hybrid program that's offered primarily online using state-of-the-art technology. I know that its first class was admitted in 2012. I know the curriculum is taught by STEAM faculty and not teacher assistants. And I know it being in Tampa is close to the beach, which makes me excited. The reason why I want to attend the Tampa OTD program is it gives me the opportunity to continue to be here for my family, which is extremely important to me. I have 4 children and I have 4 grandchildren, and I don't have to decide between furthering my education and helping other people and having to leave them to do so. So this gives me a great opportunity to be my full person in with them and within society. So my biggest consideration when choosing a program is one that's going to fit and continue to facilitate my needs and my family's needs at the same time as teaching me and giving me the tools to help other people. Cultural competence is important in consideration in the field of occupational therapy because as an occupational therapist, you need to realize and be aware there are different cultures than your own and be open-minded and accepting of other cultures. When you're, as an occupational therapist, your treatments are around the whole person. So in order to consider the whole person, you need to consider their culture and their background so that you can provide a higher level of health care. Scenario one, after finding out that other students got a copy of the exam, what would I do with the rest of the class failing and myself? I don't think the class failing or myself failing really has to do with the problem. The situation is that other students were being academically dishonest, and I would have to, although not comfortable with, discreetly letting the instructor know so that they could find out whether or not other exams have also been turned in dishonestly, which would not be something I would want to be involved in, but at the same time I couldn't stand by and not let the instructor know. That would be detrimental to the program and them receiving a degree that they did not deserve or earn. I'd have to let the instructor know. Scenario 2. Your patient in a clinic has had hand surgery and doesn't feel that they're getting better. Asks if her surgeon was a good surgeon. I know in the notation of the scenario it claims that the surgeon doesn't have a good reputation, but considering the code of ethics, I would have to say that maybe a rumor and unsubstantiated, so I wouldn't want to continue spreading an unfactual statement. As the occupational therapist, I think in order to resolve the issue, first of all, you got to take in consideration the patient, and you need to advocate for your patient. But at the same time, you don't want to start or fuel a problem by adding other unfactual statements. So in considering resolving the issue, I would have to look at other resources to figure out what would be the best way to handle. Maybe just speaking to the surgeon so that the surgeon could speak with the patient and maybe reevaluate the treatment that's going on at the time and make an adjustment to the current treatment will help improve with the patient's hand healing. Okay, when addressing the issue with the client, I think I need to be extremely careful not to exasperate the situation and reassure the client, the patient, of the current treatment, and maybe to do some adjustments to facilitate more improvement in the treatment, and discreetly actually maybe discuss with the surgeon the client's concerns and questions so that maybe he can address the problem with the patient and make her feel better, the situation. Describe your strengths. My strengths are that I have an insatiable desire to learn, passion to help others, giving more so, motivation is contagious, and I'm told all the time that I lose motivation. I love to help others and I want to make a difference. My weaknesses are probably all of the same that I just identified as my strengths. I always want to learn more, and I will always want to help more. I realize that you have several applicants. I'm sure hundreds. Can I say, why should I be chosen? Am I the best? I can't say that I'm the best. Am I the most intelligent? I can't say I'm the most intelligent. There are some amazing people out there. Am I the most caring? I can't even say that I'm the most caring because I have met and know some beautiful people inside and out. But I can say that I know I will always work with integrity, compassion, honesty, and dedication. And I will give this program and hopefully my PhD at this university and every patient that I have the opportunity to work with my very best. I realize you have lots of applications. I can't even say that I want it more than anyone else. I just know that I've worked for this for a long time, as many, many other people have. Why should I be chosen? Give me the opportunity to show you.